back to order. Next item is item 11, the Revita update. So, if you would, introduce yourself to SCR.
Yes, sir. My name is Courtney Lawson. I'm the program director at Revita Recovery in Duffield, and this is our site medical director. His name is Adrian Thacker.
I'm sorry, Mr.
Appreciate it.
We also have with us, and that I'm honored to have with us, is our Virginia Department of Health, Joey Cantrell, Dan Hensucker, and Jamie Niels. So I wanted to start off by saying Revita Centers is a comprehensive behavioral health care company that incorporates medication-assisted treatment to treat opioid use disorder. So with corporate offices based in Nashville, 8 program locations in East Tennessee and Southwest Virginia. There's actually 30 in Virginia. We have our Wickville, Abington, and our Duffield office. So our mission at Revita is to promote safe and healthy communities by empowering individuals to reclaim their lives from opioid use disorder. And our vision is we are developing a premier network of outpatient recovery centers that deliver clinical excellence and industry-leading outcomes. So Revita Recovery Centers is the only provider in Southwest Virginia accredited for office-based addiction treatment by CARD. In Tennessee, Revita is only the 5th provider in the entire state to be accredited by CARD as an OBOT. So after a rigorous review against 1,400 standards, Revita Recovery Centers has been awarded a full 3-year accreditation by the Commission on Accreditation of Rehabilitation Facilities. This new status applies to all 8 of our treatment centers in East Tennessee and Southwest Virginia. So there's also a slide in there about insurance payers. We accept almost every insurance. So treating the patient as a whole, Revita Recovery Centers works to heal the whole person rather than simply addressing the disease of opioid use disorder. We do this through a comprehensive commitment to behavioral health care, counseling, and support for both patient inside and outside of our clinics. When a patient comes to our clinic, they are seen by a care coordinator for looking for outside or community resources such as getting them jobs, in view programs, anything to assist them. They also see counseling and then a provider. As a result, we have a company culture that emphasizes clinical excellence, collaboration, regulatory compliance, and community engagement. And so I also put a slide in there of our community engagement. We actually have an affiliation agreement with both Lindsey Wilson College and Mountain Empire Community College recently. So nurses from those colleges can go and do their clinical hours. But I'm going to pass it along to Adrian.
Good morning.
Good morning.
Good morning.
Thank you all for allowing us to come back today. We have many of the same slides from last time with some additional updates that I wanted to share with you all. Talk about the disease of addiction briefly, and we'll also discuss the Opioid Abatement Authority, which is why we're here today. This first slide was something that we talked about last time. It discusses hepatitis C. Hepatitis C is one of the major public health issues facing our community today. Each person infected with hepatitis C spreads that infection to 20 other people within the first 3 years of it being infected. This graph, if you will look at it, the first part of this graph, what it does is it breaks down and shows hepatitis C infections across the state of Virginia. The darker colors, you will notice, are the areas with higher amounts of hepatitis C infections. You will see us here in Southwest Virginia, we're almost the highest category for hepatitis C infections. The next graph down below that, it is the amount of prescriptions for hepatitis C antiviral medications. So once again, the darker numbers are the increase in the amount of prescriptions. The lighter colors are the lower amount of prescriptions. So you will see that our area has the least amount of hepatitis C prescriptions. So we have the highest amount of infections and the lowest amount of prescriptions. That is an issue. That is an issue that our program has worked hard to address. So we've been treating hepatitis C now for over a year. When you factor in the fact that each person spreads that infection to over 20 other people, it's tens of thousands of infections that we've prevented thus far. A big part of what's helped us to accomplish this is a partnership that we have with the Leno Wisco Health District, the people that I have here with us today. They have a hepatitis C and HIV prevention program. It utilizes harm reduction measures as well as many other ancillary support services. And it has been an excellent addition to our program. They're at our office every week now. They provide food boxes to patients. They can provide family planning services, immunizations. They link them with the local health departments to get them appointments to address some underlying medical issues if needed. Harm reduction supplies. They even have a certified peer recovery specialist that comes with them each day. So it's been an amazing asset to our company and our community. It's been really helpful. The next slide, it talks a little bit about additional programs we have at Revita. A challenge that you face in addiction treatment is sometimes being able to individualize the treatment for what that patient specifically needs. Many patients, they don't want to have to take a sublingual product every day to treat their addiction. They would rather utilize a long-acting injection. So we have extended release buprenorphine injections. This is primarily for patients who are stable in their recovery, doing well, tired of taking something every day, and it's been an amazing asset. We are one of the very few companies or office-based addiction treatment programs in our area that provides this treatment to their patient. There was many challenges associated with doing that, but we successfully have hurdled all of those challenges because of our dedication to our patients in the community and the positive impacts that it makes. There's been numerous patients who I felt like would have been lost to engagement in treatment, which we know drastically increases the risk of an overdose, if not for the availability of these services. There is also extended release naltrexone that has a lot of evidence for alcohol use disorder, some for opioid use disorder. Recent studies have showed it can be helpful for methamphetamine use disorder. We're providing that as well on site. This next graph, it shows how the evolution of overdose deaths have changed over the past few years. So if you'll look, you will notice that synthetic opioids, the dark red line, is rising drastically. And if you see this even ends in 2019, I need to get some more recent data, but the more recent data, that red line would be well off the screen we're looking at here. So we kind of thought we had a problem before with that green line, which would have been like oxycodone, hydrocodone, and then we really cracked down on the prescribing of these things, and then there the fentanyl came in. So we have a bigger problem today than we've ever had. I will say from my interactions with people who use drugs and reviewing urine drug screen toxicology reports at our office, the prevalence of fentanyl in our community is 5 to 10-fold what it was last year. You know, it's increasing drastically. You know,
where's it coming from? Is this stuff that they talk about coming from Mexico? Is that do you have any idea?
So they say that it comes from Mexico, China, right. You know, and it's not people around here that is putting fentanyl in methamphetamine. It's just methamphetamine that's brought in here already has fentanyl in it, or cocaine has fentanyl in it, or the biggest thing that's killing a lot of people today is these counterfeit pressed pills. You know, so somebody thinks they're taking an oxycodone and it's fentanyl, and it kills them. So these pills are the same color, they're the same shape, they have the same markings and emblems. Like, they don't know until they take it and they're dead. You know, same thing for Xanax, Adderall, all these are fake pressed pills. We have a very unsafe drug supply today, and that's why we're facing this overdose crisis that we are. I always knew that methamphetamine as well as other illicit substances can be tainted with fentanyl, but it wasn't something that we've started seeing until here recently, just in the past few months. Like, many of my patients who are using methamphetamine are now regularly testing positive for fentanyl. My patients who struggle with heroin, like they don't even have heroin in their system. It's maxed out levels of fentanyl in their system. So, you know, it's I fear these trends are just going to get worse, and that's why we're here today. That's why we're here to build these community partnerships and work together to promote the safety of the community that we live in and we love so much. So I wanted to talk a little bit about risk factors for a substance use disorder. Genetics plays a big part in it from the moment that we're born. Like, some people's brains are just wired differently, right? They have an imbalance in the opioid ligand system. One person takes a Lortab, it helps their pain. Like, that's it. One person takes a Lortab, it makes them the happiest person ever. One person takes it, they feel free, they feel relaxed, you know, and all of these things are related to brain structure changes in the way that our bodies metabolize, absorb, and excrete these medications. Psychological influences is a big risk factor. We know that people with anxiety, depression, other underlying mental health issues, like those individuals are more prone to use drugs because they often use drugs as an attempt to cope with those issues. Environmental influences, as we talked about, Ms. Lana earlier, addiction, substance use disorders are very rampant in our area. Like we know this. This is where we live. We see this every day. So, I mean, if someone grows up in a family where their parents use drugs, they're much more likely to use drugs when they're older. You know, it's just because it's learned behaviors. Age of first use is a big risk factor. The younger someone is exposed to these substances, the more likely they are to use these substances when they're older. Family history of mental health or substance use disorders. And we also know that ACEs or adverse childhood experiences increases someone's risk for not only substance use disorders, but like heart disease, diabetes, many other just premature deaths in general. This graph is really insightful, and I wanted to share it with you. So what it does is it compares individuals engaged in 3 different types of treatment. Individuals utilizing buprenorphine to facilitate their recovery, ones utilizing methadone to facilitate their recovery, and individuals who are using non-opioid agonist treatment just with behavioral health interventions. And if you see the axis on the left, it shows the people who had continued use of illicit substances. The individuals who were using medications to facilitate their recovery had significantly, across the board, lower amounts of continued substance use as opposed to individuals who weren't using medications to facilitate their recovery. You know, at Revita Recovery Center, we are a behavioral health organization. We focus on counseling, we focus on care coordination, but we also understand the importance of medication. You know, we have individual counseling, we have family counseling, we have group counseling, you know, we have counseling for veterans. You know, we provide a wide range of resources for our patients in our community so that hopefully they can find the one that they connect with the best and works the best for them. I wanted to talk a little bit about the treatment philosophy in addiction. So it's important for us to recognize that a substance use disorder is a chronic medical condition that responds best when treated with evidence-based, patient-centered, and ongoing care. It's not like you go there, you're treated, you're cured, you're gone. Like, it's ongoing treatment. The most effective treatment attends to multiple needs of the individual, not simply their substance use disorder. This really reiterates the importance of a multidisciplinary treatment team, which we have at Revita. You know, we are a preferred OBAT, office-based addiction treatment program with the Virginia Arts, Virginia Medicaid system. We are the only office-based addiction treatment program in Southwest Virginia that is CARF credentialed. That is significant. And we are these things because of our role with the multidisciplinary team, because we have substance use care coordinators. They're at our office every day. We're here to help these patients, to connect them with social services, to get them help renewing their Medicaid, to get them in with their primary care, to get them in with the specialist, to make for sure they have food, to make for sure they have housing, to arrange their transportation. You know, that's what our care coordinators do. They're advocates for our patients. And then we have the counselors who our patients see regularly. They can choose individual counseling, they can choose group counseling, whatever works best to fit their recovery and their goals and their treatment. What we know is that remaining in treatment for an adequate period of time has the best outcome. The longer someone is kept and engaged in treatment, the better their outcomes. So I wanted to really hit home on this. What are the goals of treatment? When we treat someone who comes in who suffers from a substance use disorder, what are the goals? The goals of treatment are to reduce or completely stop their substance use. For some patients, they might not be completely sold when they walk through our doors that they're ready to completely stop using drugs. We meet them where they're at, we help to keep them safe, and we help them to reduce and move them towards a goal of recovery. We want to keep them actively participating and engaging in treatment. We try to restore their physiological functions. We try to help them to restore to a functional lifestyle, right? You know, so that they can take care of their kids, so that they can take care of their disabled parents. We try to make for sure that they're engaging with their probation officer or their parole officer. We see if they're doing their community service, if they're paying their fines, like, do they have their driver's license? What are they gonna do to get their driver's license? Do they have a car? Do they have stable transportation? Do they have a primary care doctor? These are the things that we're doing. So we really look to improve one's quality of life. And by doing that, we reduce the negative impact and the burden they have on our community. We want to provide the lowest possible barrier, like treatment on demand. When they're ready to get seen, we gotta be there. We gotta be there, and we gotta be ready, and we gotta be able to do that. Because it's that moment. You have a very short moment to get someone engaged in treatment. And it's really important to connect with them in that moment. We try to facilitate the patient's movement towards recovery by helping them to adopt new behaviors that support health, wellness, and purpose. There's one slide I think I skipped. Yes, I wanted to go over this real quick. Addiction is a primary chronic relapsing disease process. It causes structural and functional changes in areas of the brain that regulate reward, motivation, memory, and related circuitry. It's easy for us to look at these individuals and say, why do you do what you do? Why do you make these decisions? Right? That is addiction. It literally changes the structure in their brain. We have objective PET scans which shows these things. CTs, they show these things. It's very evident. The field of addiction medicine, we know this. So people with the disease of addiction, they continue to use substances or engage in behaviors that become compulsive despite harmful consequences. That's why as an addiction medicine clinician, it's never good to look at somebody and say, if you keep doing this, you're going to die. They know. They're very aware that using drugs is bad for them, but they continue to do it because they suffer from the disease of addiction. So when we look at addiction, a lot of people have a misunderstanding of addiction. If you have a 70-year-old woman, she's been going to her primary care doctor, she's prescribed hydrocodone for 30 years. If she stops taking that medication, she goes through withdrawals. Withdrawals is not addiction, right? She's not addicted to hydrocodone. Addiction is role impairment. It's continued use despite harm. It's not being able to manage that prescription. It's taking that medication inappropriately. It's not being able to take care of her grandkids or be there for her family or do the things that she wants to do as a result of her desire to take that medication. That is addiction. Something that's important to hit on, I spoke a little bit about it earlier, is that the brain of a person who is predisposed to the disease of addiction is different from those who will never develop the disease of addiction, no matter how many dopamine spikes they're exposed to during their lives. So this just hits home with the fact that one person takes hydrocodone, it helps their pain. They take it as prescribed. They have no issues with it. One person takes hydrocodone and they feel numb, right? They feel happy. It gives them energy. They don't have a care in the world. And this didn't happen after years of use. Sometimes this is the first use. It's the most interesting question that I enjoy asking my patients. When was the first time you took an opiate or an opioid? How did that make you feel? And when I have those patients that they just look at me and smile and they say it was the best feeling in the world, those are your people with the more severe substance use disorders. So it was nothing they had done before that made them that. They had a lot of those risk factors that we talked about and the underlying physiology of their brain. So now I wanted to move on and talk about the Opioid Abatement Authority. Are you all familiar with what the Opioid Abatement Authority is? Slightly. So the Opioid Abatement Authority, it was part of a negotiated plan for the state of Virginia to accept national settlement offers. These settlement offers were an attempt at abating or paying reparations for the damage that was done as a result of the overuse of opioids. Negotiations for this required significant involvement from local governments. As a result, the Opioid Abatement Authority was created in the General Assembly of 2021. The executive director, which is Tony McDowell, was appointed August the 1st of 2022, and the office opened November the 1st of 2022. I've met and spoke with him multiple times. So Virginia's participation in the national settlement offers. In late 2021 to early 2022, the Virginia Attorney General's office worked with local attorneys and outside counsel representing the localities and with numerous other associations to encourage cities and counties to participate and drop individual suits. What they didn't want happening is they didn't want 50 or 100 different lawsuits on each of these manufacturers and distributors. They wanted to group them all into one lawsuit. So this resulted in a signed Virginia Allocation Memorandum of Understanding, or MOU, between all 133 counties and cities in the Commonwealth. The General Assembly then passed a statute which clearly monitors the MOU. The MOU and the state clearly specify that only cities, counties, and state agencies are able to receive financial support from the OAA, right? So Revita Recovery Center, we cannot apply for funds from the Opioid Abatement Authority, right? Scott County is guaranteed funds from the Opioid Abatement Authority and can get a lot more than that. Scott County has some requirements on what they have to do, how those funds have to be spent, how they have to report the spending of those funds. Currently, there is $500 million allocated to the state of Virginia for this opioid abatement authority. There's ongoing pending legislation, or pending litigation, which is about to end. It'll make it almost $1 billion. This is a real chance. This shows some of the different distributors that there are that was involved in the litigation and the lawsuits. This graph, which is really important, I wanted to share it with each of you all. So this breaks down that $500 million or that $1 billion and how it's going to get broken up, how it has to be spent, You will see here the cities and counties' direct share, 30%. This is money that is going to be given to you. It's guaranteed. Kind of got to say what you're going to do with it, what your plan is for it. If you report it appropriately, you get an additional incentive, which I'll talk about shortly. And then you will also find that there is additional funds, 55% on the right. This is extra funds which can be granted to cities and counties, particularly ones that are able to get together and do regional partnerships. Lee County, Scott County, Wilkes County, if they can get together and do regional partnerships, and they can get even more money than what's guaranteed in the 30%. You know, so all these challenges that Linda spoke about earlier, you know, like it is substance use, it is addiction, which is the issue she faces. So we can work together, you know, in your all's position, we can work with the people who specialize in the treatment of these issues and really come get a good plan together. So this right here is the graph for Scott County. This breaks down each fiscal year over the next 17 years and exactly how much money Scott County will be given. You will see here the first column is the distributors. This is with the people who didn't make the medication but who shipped it out to pharmacies. Janssen is a manufacturer, Mallinckrodt's another manufacturer. You will notice here that Mallinckrodt don't even have all the money that they will be paying, so it's to be determined. But if you look at the bottom and you add these numbers up over the next 17 years, it's almost $750,000 that Scott County is going to be getting. That's without the money from Mallinckrodt, and that money is going to be approximately doubled once this other pending legislation is done, right? So, I mean, possibly $1.5 million, which only represents a big part of that only represents the 30%. There could be much, much more money than that if we get together and we work together with the people who specialize in treating substance use disorders. We have multiple professionals within our organization that are active with the Virginia Society of Addiction Medicine. We are currently working together to develop a toolkit to help to screen these grant applications. You know, why were we picked for this position? Because we are the specialists, right? We are the experts in this field. It's what we do. So you will see the from OAA, that column represents a portion of that 55% of extra money. And you'll see the 25% incentive. What that is representing is, I'll talk about it here in a little bit, but if you report the spending of the other money, which you're guaranteed the 30% appropriately, then you can get the 25% incentive. The links down below that are for where you can find this information and where you can find another link which talks about that 25% and how the county can help you capture that. So the statutory requirements on the use of opioid abatement funds exceed the requirements of the National Settlement Agreement. So 100% of the opioid abatement disbursements to cities, counties, and state agencies must be spent on abatement efforts, right? There was a lot of concerns with the way that other grants have been used in the past. You know, they were for one substance or one issue and it got spent on completely different things. They wanted to make for sure they did not happen with this. So that's why they've made the language so very strict with it. There is no reimbursement of previous costs or supplanting allowed. So you can't take something that you've had and been paying for and then try to get paid for it again or try to get reimbursed money for it. You can't have any indirect charges, and recipients of this money must report the outcomes to the Opioid Abatement Authority on an annual basis and allow the Opioid Abatement Authority to monitor these programs. So this is something that can be done with a partnership with an addiction medicine organization who focuses on these things. How will the use of the funds be tracked? In accordance with the statute, all expenditures of OAA funds shall be conducted or managed by a participating locality or state agency. As we said, no one else other than state agencies, counties, cities can be given this money, right? They can say, which is what most or all of them are doing, that, hey, we're going to use this money for this, we're going to partner with this organization, and they're going to be providing these services. That's what happens. That's what most of them are doing. Most cities and counties just aren't equipped to design and implement an entire program. So, but it has to get approved. Every city and county is required by law to conduct an outside audit and report its expenditures to the state. Expenditures must also be reported to the Opioid Abatement Authority. Performance measures must also be reported to the Opioid Abatement Authority. So like you're saying you're going to do this because of this reason, and how are you going to evaluate the effectiveness of it? The Opioid Abatement Authority will perform site visits and inspections to make sure everything's being done appropriately. Any concerns can result in detailed financial and programmatic reviews. So this is contact information that shows the different offices that we have across Southwest Virginia, Northeast Tennessee, a phone number that can reach all of our offices. We have attached our program director, Courtney Lawson, her business card in there, as well as my business card. My business card has my cell phone number on it. If you need me anytime, call. You know, we're not far away. We're just right in Duffield. You know, we would love to meet with you all and speak. We have many ideas about how this money could be used and the great things that it could do for our community. You all are in a very important position to make a decision which will most positively impact our community. So we would love to help you with that and share some guidance and some possible ideas. We're open for you all to come and visit our office, right? We're not far away. So many of you, I think Ms. Selma's been there, and I know you all are from other districts, but we would love for you all to come down to our facility. You know, we've did some renovations lately. It's a great place. I think you'll see that we have a really amazing thing going on.
Over on page 11, it's got those numbers up to almost 40,000, 36,359. That's the deaths. What area, how much is that, like the state of Virginia, and what area is that on page 11?
On page 11.
Yeah, the graph that shows the red, the blue, the green, the yellow, orange, whatever.
All right, let me try to hear it. That would be deaths, yes. And this is national. This is not the state of Virginia.
Okay.
Yeah, this would be national. And as I said earlier, the 2018, 2019, today in 2023, I don't think we have all the data from 2022 yet. But I mean, this number would be like off this book. You know, fentanyl is here. It's killing people at an alarming rate. You know, we've talked, you hear this term opioid epidemic quite often, and it's a really inaccurate understanding. That's not what we have today. Today we have an overdose crisis. So this is not people getting addicted to drugs and then living a life of drug use. Like, people are dying at alarming rates across our country. We've been blessed that it hasn't really gripped our community yet. It just takes time. You know, I mean, I didn't see fentanyl in our office and our toxicology screens that often a year ago. Today I see it weekly. You know, so it's here. You know, when you speak and work with local EMS providers, like you hear about how many times they're going out and responding to overdoses regularly. You know, so I really have concerns for the future, and that's why we're here. You know, like we live here. Like my family's going to grow up here. You know, we love this place. We love our community, and I think it's important that we're in a position with our skills, knowledge, and expertise that we build these collaborative partnerships with places like the health department to really promote the safety of people who use drugs, right? Because people who use drugs, they're our family members. Like they're people who live here, and by helping them, we help the whole community, right? By promoting their safety and stability, we promote the safety and stability of the entire community. And that's what these funds are for. And that's why we want to encourage you and share knowledge and do anything we can to help and support.
One thing on the opioids, Suboxone, Subutex, methadone, what do they use for methamphetamine? To counter that, what do they use? That's
such a good question, Danny. So currently there are no FDA-approved medications for methamphetamine use disorder. So the most effective interventions, right, is behavioral health interventions such as motivational interviewing skills. There's some research that shows some regimens have promise, which we use at our office. We have many patients who don't use opiates, has never used opiates, they use methamphetamine. Like, those patients are not on Suboxone. You know, they do not take buprenorphine. We utilize other medications. That's the naltrexone is one that shows some promise with it. It's a once monthly injection called Vivitrol, and then combining that with bupropion can also be quite helpful as well. But a lot of it is motivational interviewing techniques, like helping to find out where they're at and move them in the recovery, provide them with those care coordination services, provide them with the counseling services. Many, as we talked about earlier, people use drugs for a reason. Like drug use did something for them. So what we try to do is we try to find out why they use drugs to begin with. What were they attempting to self-medicate?
That's why I hear a lot of people say it's an illness but not a disease. It's a choice that they've made. And so I don't know, a lot of controversy, you can dress it up any way you want to, but it seems like it's more of a choice than a disease, but it is an illness. It's like if you get shot, get an infection, it's not a disease, you just died from the illness from getting shot. But people that are doing this, and I admire what you're doing, they need help. I know a lot of people, personally, even family members have issues with it. But anyway, I commend what you are doing, but anyway, the approach to these people to realize they've made bad choices. And so how much should be done? I mean, somewhere you gotta, I've seen people come off of it that does great. So, but anyway, I admire what y'all are doing down there, but hopefully it'll help the people get their lives straight.
I agree. Like, people have an increased risk of making that decision initially to use drugs, but oftentimes once people who have the disease of addiction are developed, once they start using drugs, it's much harder for them to control this decision. It hijacks areas of their brain.
My father's an alcoholic, and we suffered a lot because of it, and so I know what addiction is, it's called whatever, but it's pretty tough growing up in that.
I understand that. I was all sharing with Joey earlier, that's why I work in the field of addiction. My family has really been ravaged by addiction. I've lost family members as a direct result of addiction. Like, there are people that I love in this world today that I could get a phone call saying they're dead, and I know that that's what it was. So that's why I do this.
Any comments or questions for these folks?
I appreciate all that you do, and I do understand addiction. It's a strange thing. My very best friend that I ever had on this earth had an addiction to, I broke my arm one time. She took me to the hospital after I got my pain medicine. She wanted it. She wanted some, and this was a sharp woman, but she was so addicted to prescription drugs or drugs. She died in her 30s mixing prescription drugs with alcohol. But I saw her and I knew her, but she had this addictive personality, and I'd never seen anybody like that before. And I wish that she could have gotten some help.
I'm really sorry for your loss, Selma. We've been participating in the Duffield Days parade in Duffield, and actually we've won the parade contest the past 2 years in a row. So it's been quite amazing. Yeah, love it. But there was a lady who came and shared that her son she lives in downtown Duffield, right near Duffield. Her son had just passed away from an overdose, and she said, I can't help but think, I didn't even know you all was here. I can't help but think if I knew you was here and I got him there, would things be different? So that's why we're here today. Like, we're just trying to increase awareness. Like, and when it comes back to our vision and our ethics and our values, like visibility, we're here. We're here to help. You talked about she mixed prescription opioids with other pain medicines and alcohol. Like, you hear this word opioid epidemic, and it's so misleading. It's not just opiates that's the problem, right? It's addiction that's the problem. Like, it's polysubstance use. If it was just opiates that was the problem, when we stopped prescribing all the opiates and opioids, then everybody would have been cured. But it didn't work that way. Like, we got a problem that's 10 times worse now than it ever was before, because people who use drugs in an effort to cope, and unless they're engaged in a quality evidence-based addiction treatment program, oftentimes those issues just continue to worsen. Miss Joey's here. Would you like to say something?
Yeah, I just wanted to address something that you brought up earlier as far as choice and illness. I just wanted to share with you something that we see within our program is that, most often it is not choice. It is generational at this point. And when you come from a family of drug abuse, you don't know any different. You don't know what you don't know. We have numerous clients who report to us that the first time they used a drug, it was given to them by their parent. That's heartbreaking. I have 4 who have told me that they were injected by their parent at the age of 13.
Yes.
So I look at those people and, you know, for
Oh,
someone to
parents
say,
in jail.
you know, for someone to say it was choice, it's not a choice for a 13-year-old.
Right. Well, there's
And by the
exceptions.
time they know better, it's too late.
It's
And
not that my dad's an alcoholic, but I look direct because I see what it did to him.
Right.
That was a deterrent for me to do that.
but your dad didn't give you alcohol.
They would if I
It
asked
made
for
you
it. I don't do that.
That's the difference there, and that's it's something that unless you work
Right.
with these
There's
individuals
exceptions to
daily,
everything, but I
that
mean,
you
I
don't
mean, it's-
understand,
there is.
you know, that it is, at this point, it is a generational disease. We very seldom see someone who is first generation substance abuse. So it's just something for you to think about,
Right.
to consider. You, just like them, you don't know what you don't know.
Yeah.
Do
Thank
you think it's self-medication for like an anxiety disorder or
Lots of
some
people
type of
self-medicate, yes,
disorder?
because it ultimately is a mental health crisis that we are in. And so that's why it's so important that you look at the whole person and not just treat the addiction, but what's causing them to be so sad.
Anyone else?
What, how many, just curious, how many patients, I guess, do you all typically see on a weekly basis maybe or something?
It varies, you know, our patients face so many challenges with transportation. They recently changed a lot of the legal landscape when it comes to telehealth appointments, and they were hoping that it was going to, you know, drastically increase the retention and engagement in addiction treatment, you know, but it didn't. You know, and particularly for our area, because even over telehealth, it has to be audio and visual platform, and most of our patients use drugs, they don't have a phone. You know, even if they had a Medicaid phone, then they lost it, or they live in it, they don't have Wi-Fi, or they live in an area that don't have cell phone signals. So it just, there's so many different variations. I can't even put an exact number on that. I know we do amazing things for our community. Like it's really inspiring to get to work in this field and to see the positive changes. And like Joey hit on, it's really important to treat the whole person. Like Courtney talked about earlier, you know, we don't just prescribe our patients in addiction medicine, you know, and they're at the door. Like we provide a lot of times like primary care services because they don't have a primary care doctor. Like we're treating their anxiety, we're treating their depression, we're treating some mental health issues. The more severe mental health issues we refer out to get those handled, but most of them just treating some of the basic stuff, it makes such a huge difference because they don't have a trusting relationship with the medical practitioner outside of our office. If we try to attempt to refer them somewhere else to get it done, they don't go, you know, so it's important if it's going to get done, it gets done at our office, and that's why we do all those things. Like it's not just treating addiction, it's treating all the issues that contribute to the addiction or complications of the addiction, and we do all of those things.
Do y'all do testing, and what are some of the telltale signs? Because a lot of people obviously try to mask what they're doing, right?
Yes, that is such a good question, Mr. Tipton, right? So our drug screens, there's two different types of drug screens. There's like an initial drug screen that you do, and you get point of care testing results. You get a result right then. The ways you can inspect that for signs of adulteration or that they did something, we have a temperature measurement on it. It has to be between 90 to 100 degrees to be acceptable. We look at the color of it. We look for other specifications. But then we send that urine sample off to an outside lab. Right, so when we send that drug screen off to an outside lab, we get a lot of really important clinical information like how concentrated it is, the specific gravity, the pH. If they attempted to put something in that urine, it's very evident on that report. A lot of times the lab won't even run it. It's not uncommon for people to try to spike their urine specimen with like you say they're prescribed buprenorphine. They may try to put buprenorphine in the urine so it tests positive for buprenorphine, right? Well, our drug screens, they pick that up because when you take buprenorphine, your body breaks it down into a metabolite called norbuprenorphine. So when somebody does that, they have really high levels of buprenorphine in their system, in their urine, and they have none of the metabolites. So we know what they done, you know? So it's not like, shame on you, you're bad, you're horrible, you're gone. You know, it's like, what's going on? Talk to me. Why did you feel the need to do this? For most of them, they're using drugs and they didn't feel comfortable talking to us about it.
Some of the telltale signs?
The absence of the norbuprenorphine metabolite not being in their urine specimen, it not checking an appropriate temperature of 90 to 100 degrees Fahrenheit, the creatinine being off, many of those things. We have very, very useful tools based upon evidence to evaluate those things.
And something that we could see, or a family member could see.
that if somebody's using drugs, a telltale sign of someone who's possibly using drugs, just the changes in behavior, right? You know, there's never like a standard. Some people are just sad, some people are just hyper. But when you have these significant variations of it, you know, and you see that they're not able to fulfill their roles in life, right? Like they're not able to take care of their kids. Like they lost their job, they're losing their driver's license, they're not, you know, seeing their probation officer, they're not paying their fines. Like the biggest hallmark of addiction is role impairment. So if you see someone who is unable to fulfill their roles in life, and you see this erratic changes in behavior, you see the people that they're around, you know that those people use substances, all of these are concerns, you know. So I would encourage you to get that person to go to a program and just talk to them, you know. So the statistic that bothers me the most, right, is that only 1 out of 20 people who suffer with the disease of addiction receive evidence-based treatment, right? So only 5% of people who suffer from addiction receive treatment. And when we look at why, it's stigma's part of it, barriers are part of it, but most of them feel like they don't have a problem. So today, you have people dying before they realize they have a problem. So if you have any concerns, encourage them to go speak with a clinician who is skilled in these things and can provide them with an appropriate evaluation.
Thank you. Anyone else?
Do you all have to have an appointment for a new person coming in, or they just drop in?
That's an excellent question too, right? As we talked about earlier, like when somebody's ready to get in treatment, like they got to be able to go right in, you know. So I will tell you, I like if someone walks into our office, they are going to get seen. Like we do not turn people away. We accept walk-in appointments. That is a very important thing to our organization.
And while you're on TV, you need to give them your address exactly. So a lot of people watching TV might not know where it's at.
Yes, so we are located at 198 Ross Carter Boulevard in Duffield, Virginia, Revita Recovery Centers. We're there Monday through Friday, 8 to 5, Tuesdays 9 to 6. We have an after hours line. You can reach our staff 24 hours a day, 7 days a week. If it's 2 o'clock in the morning and you want to make an appointment for the next day, you call. We can do that for you.
And what's this close to?
What's this close to? Duffield. So Duffield is between Gate City
No, I
and
know where Duffield
It's in Thomas Village.
Thomas Village.
Yeah, in front of Thomas Village. There's 2 skilled nursing facilities right there beside us, right? What is it? Ridgecrest and
Kingston Center.
Kingston Center, right? We have vinyl siding on the outside of our building. We've done a lot of remodeling recently, so we would love to have you all.
After this meeting, we may stop in after a while.
That'd be great.
Yeah.
So give me a heads up. Let me know when you're coming, so I can make sure I'm there. You know,
All right.
call me anytime.
Thank y'all for coming.
Thank you, David.
Appreciate you coming. All right. Good presentation. Next item is Mr. Cox is here on the Smart Scale program. So you've listened to a lot today. Do you feel blessed or cursed?
I feel great to
All right.
be here in Scott County. I'm a native of Lee County. And thank you, Mr. Chairman and the board, for allowing me to speak for a few minutes. My name is Terry Cox, 895 Cane Gap Road, Duffield, Virginia, in the Steepleyville community. And I came here today to give you some helpful information. The VDOT, the Smart Scale Public meeting, May 15th, 4 p.m. at the Abington Community College for the primary state road meetings. And I've been going to that for years to try to get improvement across Powell Mountain, US 58 from Steepleyville to Duffield. And we finally got some work on the Lee County side. And I've been working with the supervisors of my home county, and they're turning in their application to get it to the bottom of the mountain on the Steepleyville side. And that is to be turned in by the 1st of August. And we score really high on that corridor. Only the Weber City corridor and the Interstate 81 score higher than that traffic and the metrics that they score. That comes in number 3 in far southwest Virginia. And I'm asking for the board to send a letter to the meeting or to be there to push for pacing lanes on the westbound lanes on 58 coming from Duffield to the top of the mountain. The reason we need this on both sides and the reason Lee County is being proactive is because we have slow-moving traffic, heavy traffic, and it's going in the direction of our jobs eastward towards Duffield and the Tri-Cities, and our social activities and our advanced medical. And then we got our everyday supplies, heavy trucks going to and fro across it, and it connects I-75 back to through Cumberland Gap back to 2681 in Tennessee. And just ask that the board step up and send a letter or be there at that meeting and start being proactive on their side of the mountain, getting pacing lanes on that westbound lane. And thank you. I would like to turn in this. I was in Danville, Virginia a few days back. I go that way off of I-77 on the 58 to Danville, and I have to go due south into Chapel Hill, North Carolina to visit family. And they were the 58 project across Lover's Leap at Stewart, Virginia, the highest elevation on US 58 from Virginia Beach to Cumberland Gap, moving 22 million cubic yards of earth. And so surely we can get some work, like I told the Lee County supervisors, we can get some work on the Powell Mountain to alleviate those issues we have that I just spoke of. And I'd like to turn this in to the board.
Okay, thank you.
Thank you a lot, and I appreciate what you do for Scott County and the region. Thank you.
Thank you, sir.
Thank you, Mr. Cox. I agree with you. Passing lanes are very needed on that highway. I've experienced it, but it's a real problem.
All right. Anybody have any comments for Mr. Cox? You know, that's Selma did, so anybody else? We'll look at it and see what we can do, and but we have discussed this, you know, prior to the meeting. We'll discuss it more. We'll see what happens with it. Thank you for coming. Appreciate that. Next item is the Scott Service lease. So, Ms. Starnes.
The lease is on your tablet. It is for 6 months, and then we'll move to monthly afterwards, depending how long it takes to get permanent space for Scott Service. The need for this came about because of the demolition project with the old jail and the annex building that would take the space that they are currently in. And I'm asking for authorization to sign the lease pending approval by Soil and Water, and also $3,000 from your contingency fund for 2 months and a security deposit.
We do all that in one motion. Do we divide it up?
I think you can do it all together.
Okay. All right, need a motion to authorize Ms. Starnes to sign this lease, and then the $3,000 from our contingency fund. Any discussion, or somebody make a motion?
So moved.
Which one make a motion? Darrell?
Yeah.
Darrell made a motion.
I'll second.
Mr. Ricky second. Any discussion? All in favor, vote by saying aye. Aye. Opposed? Motion carried. Next item is Mr. Kilgore's here on the enterprise zone incentives. Do it, John.
Good morning, members of the board.
Good morning.
Thank you for the opportunity to share about the enterprise zone. Scott County, of course, is in one of the 57 designated enterprise zones in the Commonwealth of Virginia. So that enterprise zone means there's certain tax advantages of moving into that enterprise zone. It's a way that the county can match a state grant. If we have an industry that wants to move in the enterprise zone, it's also a way for you all to entice businesses to move within that enterprise zone. The enterprise zone comprises of basically all of Duffield, and it travels 23 all the way to River City, and it goes to the town of Gate City, and then it goes all the way to Nicholsville on 71, and then all the way to Dungannon as well on 72. So it's a good way to entice the economic development and investment in those areas. So as a result, we've got 3 companies that actually qualify for enterprise zone incentives, and one of those, of course, is Temper Sealy, and I don't think there's ever been many times they haven't come and talked about that because they had so many expansions, or VFP, either one. But as a result of the 2013 expansion, Temper Sealy has qualified for a machine and tool tax grant and real estate tax grant of 60% by averaging over 2.5 times the minimum wage rate. They paid machine and tool taxes on that expansion totaling $27,587.99 and real estate taxes of $4,997.59. Their tax grant will be $19,551.34, providing you all vote for that. And I might say on these, we actually verify their average hourly wage rate, and we have to also verify that they pay their taxes. So they do, all these have paid their taxes. Also, as a result of the 2013 expansion, VFP is another one. They have qualified for machine and tool tax grant and a real estate tax grant of 100% by averaging over 2.5 times the minimum wage rate. They paid machine and tool taxes on the expansion items totaling $14,214.03 and real estate taxes of $25,692.29. Their tax grant would be $39,908.32. And as a result of, you also can, I talked about the business growth in the enterprise zone. This is photogenesis. They did qualify for a real estate tax grant of 40%, averaging over 1.5 times the minimum wage rate. They paid a real estate tax of $2,782.40. Their tax grant would be $1,112.96. All of these, of course, have expanded in the designated enterprise zone in Scott County. And I might note too that these expansions on Temper and VFP, this is just a portion of the tax that they pay to the county. This is only 10% of the total tax they pay to the county. So, a lot of people ask, well, why are you giving a tax break? But you're actually not. It's only a portion. It's only on the expansion. So Temper will not roll off. They'll roll another expansion on next year, and VFP will too. Both of them have expanded again. So you'll see them again in future enterprise zone applications.
Okay. John, VFP, you said 39,208, or 908, is it 906?
906.
Okay.
I might have missed.
I'll make sure we vote on
read
it.
that. Sorry, 906,
You need my
32.
glasses.
Yeah,
All right.
I might need your reading glasses.
I want to make sure when we vote, I'll get the exact dollar amount, so we'll be exactly right. So,
Thank you, Danny.
all right. Anyone here, any comments or questions? All right. It's very important, this enterprise zone is work for the county and for businesses. I appreciate them doing that, but it's a payback to them as an incentive. So anyway, in discussion here, if not, we entertain a motion to pay the amount. The total amount is $60,570.62. Do we have a motion?
I'll make a motion that we approve the incentives.
All righty. Ms. Hood made a motion. Do we have a second?
I'll second, Mr. Chairman.
Mr. Tippin, second. Any discussion? All in favor, vote by saying aye. Aye. Opposed? Motion carries.
Thank you all for your support. Appreciate it.
Thank you. All right, next item on the agenda, pages here, is the opioid abatement grant application, and so you have that, Sally, to read? Okay.
We have a presentation.
Okay. All righty.
Good morning.
Good morning.
I'm Sandy Odell, and I'm the Executive Director for the Community Services Board, and we have Christy Hammonds, who's the CEO of Frontier Health, with us to talk about a joint application project between the 4 localities in our region, Lee, Scott, Wise, and the city of Norton. And we want, after talking with the county administrators and the city manager, to submit an application to the State Opioid Abatement Authority for a cooperative partnership with the 4 localities to establish an intensive outpatient program for children, working with kids who are at high risk for substance use disorders or who may already be using substance abuse. We want to be able to prevent those kids from becoming addicted or in the same situation that many of their parents or grandparents are in, or other family members. We would request a local match from your local distribution of the opioid abatement money. The total project would be for up to 5 years with the State Opioid Abatement Authority funding. And we would ask for an allocation of $10,254 from Scott County's distribution. Each of the 4 localities would give an allotment for that based on your local funding. So it would be in ratio to what your local funding is. The total project for the first year would be $346,000. And your portion of that then would be $10,254. We're asking to match the project with 20% total from the 4 localities. And Scott County is our last meeting of the week, and the other 3 localities have approved that. So Christy's going to talk about the intensive outpatient program for kids.
Again, thank you so much for your time today. This program is an intensive outpatient adolescent treatment program. It's Monday through Friday. Our hours currently that we're looking at are 8:30 to 2:30, Monday through Friday. So while in the age range is 13 to 18. So really kind of focus on our kiddos who are getting up to that age where they're struggling in school. Maybe they've had some truancy issues. They could have been court involved or not court involved just yet. Maybe they're a referral from one of our community partners that we work with or the school system. So we would be working in collaboration and coordination with our juvenile courts across all the localities as well as the school systems to identify at-risk needed kids from 13 to 18. They may be behind in school, so while they're in the program, we would be working with them on that educational component to keep them either up to speed with where they're at, grade appropriate, and or get them caught up, as well as individual therapy, group therapy, family therapy, to kind of provide those wraparound services as well as case management and coordination. Again, all of this would be in collaboration with community partners, whether or not that be their counselors at school, teachers at school, court system, whatever judge could have ordered this treatment and care. From a timeline, it looks like kids are usually in the program between 3 to 6 months for treatment before graduation. We do have evidence-based curriculum that we use for this program within our group therapy. So we use 2 different forms of evidence-based curriculum for group, and that's our Hazelden curriculum and the matrix model. And as far as individual therapy, we use cognitive behavioral therapy and a new tool, EMDR, if you've ever heard of that, is eye movement desensitization treatment and care. That is a new tool that we've been using a lot with individuals who've experienced trauma. And we know a lot of times these children and these adolescents have experienced trauma in their homes or other areas. So just trying to kind of think of some of the other things that you guys would want to know from a timeline perspective. The application I think is due Friday.
So we've got everything about pulled together to be able to get that submitted. Should we receive funding, we're looking at trying to get this program up and running probably early fall, so looking at September, so right as they're getting back to go to school in August. Hopefully by September, we'll have this open and ready for referrals. Our current location that we're looking at right now is at our Big Stone Gap location, right there at the line. So that way we'd be able to serve all localities starting out. As we see the growth in referrals between what counties, we may end up having additional programs within embedded communities, just depending upon the growth and the need that we see. Trying to think.
Is this $10,254, is that for each year, for 5 years, or is that a total for the 5 year?
We're asking for it for the first year, and then we have to resubmit a budget every year beyond that. And
So this would be for 1 year?
For
it's
1 year,
10,254.
So that brings up a good point for years 2 and 3. And so a lot depends on if we need an additional program from a budget perspective. So we are looking to anticipate growth. The other thing is we will be able to bill Medicaid for the adolescents who have Medicaid for intensive outpatient program services. So this, of course, would be licensed through DBHDS, and of course, we would get accreditations and so forth as appropriate for the state. So just we hope to kind of build in some sustainability around that. So hopefully, our budget year to year would decrease as far as what our needs would be. Good question.
Okay. Any other comments or questions for anyone? So 20% allocation would be $10,253.71. Is that correct? That's the exact amount. Okay. All right. Any more comments or questions? All right. Your office thoughts on this approved? This amount. Ms. Starnes, you want to chime in here and see what? We got everything in front of us here, but.
We currently have about $125,000 that we've received in opioid money, so we have the funds available for the match.
Okay.
And like they said, they've been meeting with the county administrators from Lee Scott Wise and the city manager of Norton, and they have, some programs that they've been working on that they think would be good fits for opioid funds. This is for a regional project, so it's for a pot of money that you have to apply for through the state. And like they said, the grant application is due on Friday.
Okay.
So.
All right. Need a motion to approve the amount from that settlement. Do we have a motion?
So moved, Mr. Chairman.
Ricky made a motion. Do we have a second?
I'll second.
Ms. Hood, second. Any discussion? All in favor, vote by saying aye. Aye. Opposed? Motion carried.
I also need authority to sign the grant application. Wise County will be the fiscal agent for the grant, but each of the county administrators will need to sign.
I need a motion to authorize Ms. Starnes to sign that necessary documents. Do we have a motion? Jeter made a motion. Do we have a second?
I'll second.
Mr. Tippin, second. All in favor, vote by saying aye. Aye. Opposed? Motion carried.
Thank you so much for
Thank you,
your
ma'am.
support.
Well, that was 15A. Item 15B we added to the agenda. Ms. Starnes.
In your packet, you have the RIFA resolution. Back some time ago, each locality in the RIFA footprint adopted a new tax rate for data centers, and this resolution is in support of data centers for the Lonesome Pine Regional Industrial Facilities area, and to recruit based on that tax incentive. So within the next month, each of the localities, which is Lee, Scott, Wise, Dickinson, and Norton, will be considering the same resolution.
Okay. The resolution is in your packet if you had a chance to look at it, so we'll need to get this done. So we do have a motion to approve this resolution as presented to you.
I'll make a motion.
All right. Mr. Tipton made a motion. Do we have a second?
I'll second.
Jeter, second. Any discussion? All in favor, vote by saying aye. Aye. Opposed? Motion carried. All right, item C, ARPA.
We have 2 projects we would like for you to consider using ARPA funding. And that would be for budget items for next fiscal year, 24. We're asking for $84,000 to be for the volunteer fire departments. That's $12,000 each in fiscal year 24 budget, and $200,000 for EMS payroll support in the fiscal 24 budget.
All right. And y'all serve on our ARPA committee. Appreciate what you do in this. It's been a tough thing to have to do, but you've done well with it. So again, I thank you for what you're doing. So we need a motion to approve this money to come from that ARPA, these ARPA projects we approved from that pot of money. Do we have a motion to do that?
So moved.
All right, Mr. Bricky made a motion. Do we have a second?
I'll second.
Mr. Tippin, second. Any discussion? All in favor, vote by saying aye. Aye. Opposed? Motion carried. All righty. Ms. Dicker's here on bookkeeping. If you would.
Please appropriate $15,000 to Tourism ARPA Grant 72600-5637 for monies received and deposited at the Treasurer's Office. Appropriate $477 to Sheriff's Office repair and maintenance of vehicles 3120-6009 for an insurance claim received and deposited. And appropriate $20,821.41 to Sheriff's Office DCJS CESF grant number 8866 as listed below for reimbursement received and deposited at the Treasurer's Office. 3120-1100 salaries $14,396.16. 2100 employers FICA $1,040.61. 2210 employers cost VRS $1,984.37. 2300 employers share health insurance $3,205.62. 2400 group life insurance $173.25, and 2600 unemployment insurance $21.40.
Ready? Do we have a motion to approve the appropriation as described by Ms. Vickers? Do we have a motion?
So moved.
Mr. Jeter made a motion. Do we have a second?
I'll second.
Ms. Atkins, second. Any discussion? All in favor, vote by saying aye. Aye. Opposed? Motion carried. Next item is Ms. Tina's here on appointment, so if you would the same.
You have two appointments for the Recreation Advisory Board. These are by district. District 1, Betsy Gibson has been serving, and she no longer wants to serve on this board.
Okay.
Derek France has been trying to find someone for that, but he was unable to do so. Keith Warner has been serving for District 3. He did not submit an application, but he is interested in serving.
Okay. Start with District 1. Do we have any nominations for District 1?
I've talked to some people, Daniel, but I haven't got no names back yet. I'm still working on it.
We'll look at it again in June. Okay. So no nominations for there. Do we have any nominations for District 3?
I nominate Keith Warner.
Okay.
I did talk to him yesterday.
All right. Any other nominations? If not, entertain a motion, nominations cease, and we vote by acclamation.
So moved, Mr. Chairman.
All right, Mr. Tippin made a motion. Do we have a second?
I'll second.
Ms. Atkins, second. Any discussion? All in favor, vote by saying aye. Aye. Opposed? Motion carried. All right. County Attorney items, Mr. Kegley, have anything for us?
I don't have anything to do.
All right, anybody have any comments or questions for Ms. Kegley? All right, thank you, ma'am. County Administrator items, claims, Ms. Starnes.
The general fund balance is $12,378,551.27 after claims for this month. As you can see on your comparison chart, we are quite a bit above where we were this time last year, but we are still waiting on an invoice for the school system to pull down their allotment. So with that taken into consideration, we're right on line with where we were last year. Early claims for the month totaled $153,873.63. Current claims total $156,284.84. So total claims for the month, $310,158.47.
What is that treasurer's review Oh, okay, okay.
That's Scott Gerald's area. You know, let me say something about that. I was over at David Mann's farm the other day, and he was there. I did not realize what they do. He was there going through all of the stuff, the pH stuff, the magnesium, and all stuff, so I was really surprised that they did all that. And he went through it, you know, I was trying to learn something there, but I didn't know they worked that close with the farmers to do that stuff.
He also has been a big help at the golf course, working on the grass and getting all of that in good shape. So he's been a big benefit for the county as well. But there is a budget section in our county budget for the extension office, and that's what this is in relation to.
All right. Any comments or questions from the Starnes about paying the bills?
I'll make the motion that we pay the bills.
All right. Do we have a second?
I'll second.
I said second. Any more discussion? All in favor, vote by saying aye. Aye. Opposed? Motion carried.
I have a couple things under miscellaneous. The MEOC Walkathon, which the county helps sponsor, is going to be held Sunday, May 7th at 2 o'clock at Bullock Park, and you all are invited to participate if you would like to do so. And the loader lease, our loader for the transfer station is being repaired. We need to ask for another month of lease from contingency, $5,500.
Gotta have it. Things so important to that center. All right, do we have a motion to take $5,500 from our contingency fund to, on this loader lease?
Yeah, I'll make a motion.
All right, Mr. Herron made a motion, do we have a second?
I'll second.
Mr. Reader, second, any discussion? All in favor, vote by saying aye. Aye. Opposed, motion carried.
And the next thing I have is purchase of a Ford Explorer. The total amount is a little bit different from what is in your packet because of delivery charges. We can either pick that up or have it delivered for so many cents per mile. So the total for your consideration is $38,434.85. And this would be on state contract, and it would be for economic development. And it would be paid for with the local area tribal consistency funds.
Where would the pickup be?
Richmond. It's Sheehy Ford. They're on the state, they have the state contract.
All right. Do we have a motion or any more discussion? Do we have a motion to approve this?
I'll make that motion.
Mr. Bricky made a motion, do we have a second?
I'll second.
Mr. Tippin, second, any discussion? All in favor, vote by saying aye. Aye. Opposed, motion carried.
That's all I have.
Well, thank you, ma'am. Next is Mr. Kilgore's here with the EDA, so come forward, please.
If you hold down another couple items, maybe everybody's gone by then.
Yeah.
I'm just kidding. I kept watching people leaving.
Yeah. They don't want to hear you, but that's what it was.
That's it.
Yeah. We want to.
Hold on just a minute while that comes up. Appreciate the opportunity to present. Appreciate y'all supporting the enterprise zone, of course, for all business. Seems like I was just here, I think it was February, but anyway, since then, we've had a great announcement here for Duffield. And, you know, you think about how long some of these projects take, they take time, a lot of time. We started working on this one in 2021, and finally you see this coming. So they'll start construction there. This is a Family Dollar, Dollar Tree store. That is the footprint that's going to have beside Hardee's in Duffield, and right on 58. So they worked on that. A lot of permitting issues and things like that that they had to go through. And of course, you got the river that's close by, DEQ permits, and all kinds of things that we have to work with them on that. We do some of that with retail, and you know, that's an example of one company we work with. We've worked with financial institutions before. We've worked with McDonald's before, and Food City. So we do that occasionally, and a lot of times that they're having some type of issue or need help with assistance. I guess the first one I really got involved with was Eastman Credit Union here in Gate City back in the day when they had an issue, and we helped them out with that, and the county did. So anyway, it's just an ongoing process and things you have to work through to entice business and keep them, moving on their schedule that they want to, grow their business here in the county. We appreciate them. We also appreciate Dollar General. They're two of our big retailers here in the county. Of course, Dollar Generals are everywhere, but the Dollar Tree is moving that way too. Again, we promote the Riverside, of course, property. We continue to work with the Landstar Development and working with Virginia Housing Authority currently on a potential grant to assist that project. But they continue to work on the final design. We have a meeting with them this afternoon, and hopefully we'll have further details, but we have not got the final yet, so maybe he'll bring that this afternoon. So we're still working with them on that. He's also been able to, get the message out on the Riverside property on our behalf to potential retail businesses, and that is a good thing as well. So he's helping us market that as well. And that was the area that he looked at and, approved by the Planning Commission, was the area for housing development, and they approved that last year. Also, another large project we've been working with is the AMBER grant through the Virginia Department of Energy. Of course, used to be Department of Mines, Minerals, and Energy. A lot of y'all know, but now it's Virginia Department of Energy. The total budget for this project was, of course, to improve the trail since the parking area has been improved. And a part of this one was to improve the parking area on the National Forest property. So if y'all have ever been on that and parked there was a lot of, you really had to have four-wheel drive to park there most of the time. There's some cars that
hard to park a Prius there.
Yeah, there's some cars actually got stuck there before. So this was a part of this project, but we haven't been able to do that part of the project yet. We've been mainly focusing on the trail with Appalachia Conservation Corps. So the estimate on the project was $353,430.18. The great thing about this is Ambler, they just approved additional funding for the trailhead parking area. So once that's approved, they haven't given us an amount yet, then we can put that money and help the Jefferson National Forest improve that parking area. Hopefully the next time we bid that out, we'll have the funds to do that. So that was a good thing. Now, you may see people, if you go up there, that the ACC folks will be working. They've had one crew working there, and they hope to get another crew and have double crews and finish this project by
Are they
July.
camped out up there when they come to?
They are camped out on our property and then working on the trail. That's what they're doing.
Well, they were a couple of years ago, they were hanging out there working on that trail. They probably 8 or 10 of it actually.
That's what they love to do, just camp there and then work on the trail. Yeah. So improvements in the trail, and hopefully at the end of this we'll have not only be safer, but they'll have signage. So, people will know how to get in and out of there.
Roger Carter will appreciate that.
Yeah, I think we all will.
Yeah.
Is there Wi-Fi up there where you could use?
There's Wi-Fi at the barn and area where the parking area, where the county parking area is, yes. So that's why they like to camp there, is because they've got Wi-Fi there too, so. Also working with TVA, Mountain Empire Community College. This is on a workforce investment grant, so helping them with, trying to entice additional workers and communicate this to hopefully high school students as well. So hopefully here this year we'll be presenting that in the in-service days when the teachers go back, and have some employers talk to them about some career paths and things that they have in Duffield. So this only covers the Duffield area, remember, because it's a TVA grant. So we'll help those in the TVA area, and hopefully get more people in to apply for jobs for these career paths that they have in Duffield. Because not only is it hard to find workers in social services, it's hard, period, for them to find workers in skills And that's across the nation. That's not just in Duffield, that's across Virginia and across the nation. Skilled labor is hard to find. Welders, electricians, all that's hard to find. If you're building a house, try to find somebody to build that. You're a long delay on those now. We also have a Scott County, our Rural Business Development Grant, and that's through the Rural Development. We've had 38 loans approved to date and $697,700. Now that's not the total grant that we've got. This is a revolving loan program, so we loan that money out and then we get it back. We can re-loan it again. So 6 of those businesses have been tourism related, 22 retail and 10 support businesses, 83 employees. The board just approved 2 new ones. You'll be hearing more about those based on, we have to verify collateral and things like that. And you'll be hearing one of those is in the Duffield area and one of those in Nicholasville. So we'll let you know as soon as they want to be ready to cut ribbons on those.
Is there an interest rate on those loans?
We do have an interest rate, and that's by our policy. It's 2% nominal interest rate. So then they give that back, then we loan that money back out. Right. So we just put that in the pool so we can loan it back out. Ribbon cuttings, we had the Mammoth's House Airbnb, and we also the De Pomeray restaurant. That's a hard one to say, but hopefully that's right. So the Greek chili restaurant, and we hope that you all go out and try that one. And as far as the Airbnb, you probably have stayed at those at other places, but probably not in Scott County. But tell everybody we have Airbnbs in Scott County. I know of one, believe it or not, and Selma used to work at ECO, appreciate this. So there is an easement shutdown. And I know of one that they have rented that through the rest of the year to 2 people that are coming in working a shutdown at Eastman. So that's pretty. I couldn't believe that was happening. So that was good.
Can I speak on the Airbnb? We do have Airbnbs. Most of our people go to Devil's Bathtub. My wife has one here in Big City, and she has a doctor coming in, I think, in a week from Germany, staying a month, and he's working over in Norton. So it's universal. It's not just here in this area.
And we do have the VCTA, which is the regional grant funds, and this program provides grants up to $10,000. They have changed that program a little bit, VCTA has, so it's not, they don't fund a lot of the service industry much anymore out of this, but they will do other types of business. So I would have to get with the Small Business Development Center to see if they qualify these new businesses. However, they do qualify for our loan program, so we continue to work with Small Business Development Center on that. Small Business Development Center has an office in Duffield. Of course, that's out of my Empire Community College. 15 Scott County businesses, though, have received grants from VC in the past on the city capital, up to $145,000. And then we have our the grants through COVID, and just a reminder of that, about $1 million y'all invested in small business throughout the county, and that was really good, and businesses all over the county. There's a map of where they were located within the county. And we continue to market our assets, of course, all over the county, Duffield, and the industrial park, Creek Road Tech Building, also Riverside with Landstar Development. We also have interest in, we help promote other lands like the mine in Duffield as well. Any questions?
Anybody? Anything? All right.
Thank you.
Appreciate it. We're getting close to the end. Lunchtime kicking in. All right, comments, requests, recommendations from the Board of Supervisors. Mr. Jeter, do you have anything?
I'd just like to thank everybody for the prayers and the cards, and nice being back.
Glad to have you back. Missed you. All right, Mr. Tipton.
Yes, I would like to thank the board and for what you do, and also the staff for what you do in terms of the county. And I would like to, last month I spoke about some possible funding for the Veterans Memorial. Our veterans, they've served and they continue to serve. That tank out there is in bad need of restoration. And so our group had, as we mentioned the last time, and I sent to the budget committee a flyer. They have it, Mike and Stephanie. And we've raised, as of to date, $3,000 already, and we have promises of other coming in. And so I would just like to, and if you have any questions, please ask. I would just say with our veterans, the Honor Guard does a tremendous, an awesome service for those that have passed and for those families. They have oftentimes 2 and 3 funerals a day, and so they work arduous hours in that capacity. So what we're asking is something to make our Veterans Memorial out there on Highway 72 to get it looking back good again. And would appreciate any help that our county would do. We'd just ask consideration for whatever amount that you determine from the contingency fund that would help us to get this thing started, get it rolling. And that's all I have.
Okay. Do you have a recommended amount that you want from the contingency fund? I mean,
well, I left it with the budget committee. I'm not sure what amount.
We'll see what comes out of that. Maybe in the June meeting we do our budget stuff. We can see that after that way.
If we went out and do that, maybe we got the either out here or in our this afternoon discussion.
We'll discuss it then too. Yeah.
Okay. I don't know. I mean, I don't know. $1,000 maybe.
What do we have in contingency fund for you? Do you know?
You have about 20 left.
20,000. Okay.
Do you have a figure what it's gonna cost?
Yes, we do. At $10,000, we've already raised $3,000. We have the promise of another $2,500 coming in, and so we have other donors, in the mill. So it's not like that we're not doing anything. So we're working hard to reach our goal, and I feel pretty confident that we will. And so we would appreciate any consideration that our county would do to help that endeavor.
Okay. All right. Thanks, sir. Mr. Herron.
Appreciate what everybody does. Thankful about the road situation. Seems like Snowflake's gonna maybe in a few years get some relief of all the situations. But anyway, I thought this was going to be a little easier than what I thought it was going to be, but I don't think it's going to be. But come August, I've got to start some training, and I will not be able to be here come the September meetings through the end of the year. And I've thought about it, and of course, we do a whole lot more than just sit in this seat. This is the easy part. I think a lot of the times out in the public is the trying to figure out situations is the hardest part. But anyway, I've decided just I'm going to resign. I'll be here till August. But the August meeting will be my last meeting. Appreciate the opportunity, the people. Appreciate you all. But
Jeremy, you've been an asset to District 3, I'll tell you right now. I mean, I know what goes on, not only here, and when I talked to you there yesterday evening, you told me what your intent was, and if I thought I could talk you out of it, I'd have tried, but I didn't. But you have been an asset, and I hope the people in District 3 realize what they have and what they've had in you, what they have in you. So you have served your county, your district well. So.
But anyway, that's just what I have to do. That's just part of it. And appreciate the opportunity.
We thank you. Anyone else want to comment on what you just said?
I appreciate Jeremy for what he's done. He's definitely been an asset to our board. And I reached out to him many times, and he has likewise. And he's been a team player, so appreciate your hard work.
Yeah. Anyone else?
I would love to say, it has truly been an honor to serve with you. And I appreciate just being able to sit here with you and work through these things with you. I mean, we've had a rough three years.
That's true.
And you have handled it with integrity and grace, and I admire that. And I appreciate what you've done.
Anyone else?
Best of luck in whatever you're going into, your endeavor, whatever it is. Be good. The whole board's been great to work with. I appreciate all of you, you especially.
Yeah. Anyone else?
You've been a real asset, Mr. Heron. I will miss you. Not only have you worked really hard for your residents in your district, but you've added a lot to the county, serving on all the committees, and you've just been a real asset, and you'll be very much missed.
Anyone else? Not, like I said, I talked to Jeremy yesterday, he told me his intent, and a lot of people have the misconception, this is all we do. Folks, this is the easiest part of being on the board of supervisors, what we're doing here today. And somebody said I need to make a copy of my calendar each month to show all the other things we have to do that's tied to this board. We're serving on social services board, at APCA, I mean, I'm on 3 or 4 boards myself, then on Wisco, that we have to do. And it's all a part of being on this board. And so people that is desiring to sit here, I hope they don't think this is all you do. Somebody posted on the internet that we get $150 an hour for sitting here. You know, we get paid $300 some a month for a 2-hour meeting. And I didn't respond to that, but there's a level of, I'm not gonna say ignorance, there's a lot of things I'm being, not stupid, ignorance, you just don't know, I don't have to find an airplane break to that. But Jeremy, what you've done here, you had an impact there, and so anyway, it's been an honor serving with you. So anyway, we wish you well as you go on. But anyway, like I said, this is the easiest part of what we do, is these meetings. Even though it can be contentious sometimes, we got to deal with things, it's the easiest part. Mr. Brickman.
Last meeting, Steve Pike came and addressed us, Spearhead Trails, the new director, I suppose, the supervisor is his name, is his title, but several of us went up there a couple of weeks later and met with him and took a good side-by-side ride over Scott County. It's in Scott County, the property up there. And I said this 2 or 3 years ago when Danny and I went up, and I still think it's a gold mine on High Knob up there, and Wise County is going to develop more on their side. And we are getting, it's 3 or 4 miles, which is it?
It's 6.8 miles total unpaid, about half of it's going to get paid from the Wise County side down.
Yes, and eventually, I went up 615 and then came back down and built on the east side. And Bart Camp Lake is down there. We've got Devil's Bathtub, of course, and if we could get 615, a better way to get in there. That road's rough right now, but to get a better way to get in there. Eventually, it won't be during our terms, but eventually that'll be a great recreation site up there. But I'm glad to see Steve Pike come in here. I think he's building a home in Scott County, and he'll be an asset to the county over the
The thing about that paving is, it's FLAP, F-L-A-P is the acronym, it's Federal Land Access something or other, that's what the acronym stands for. So it's federal dollars doing that. It's not, it's nothing, that's doing our 6-year road plan, nothing like that. It's something the federal government's doing to get an access into that. Now, if you kept up in the city of Norton, what they're doing, they're building that, they're really promoting the high knob. But you can get there, it's paved, you can get there easier from that side. But one day, you know, and I told one guy, I said, you know, the north side of the mountain's the back side. We're on the front side. You're on the back side of the mountain, but they don't like that. They said they're the front side, we're the back side. Doesn't matter, just play on words. But anyway, good point. I'm glad that they're.
And appreciate Lisa going too. Lisa rode up with us that day.
Good, yeah. Good.
Got to ride around. Saw Beach Mountain from the back side.
That's good.
I told her that on the way up, and I don't think she believed me.
That project is in your plan that you adopted today. It's 2 miles and construction
It
is
is.
supposed to start in October this year.
Okay, good.
It is. All right, anything else, Mr. Briggs?
No, that's all.
All right, Ms. Hood.
Well, I'm pleased to see Mr. Jeter back. Was concerned about him, glad to see that he's well. And I was pleased with the EDA report, and a lot of Duffield was mentioned several times, which is dear to my heart. Town seems to be growing. It may be a large city. I may be mayor someday. But, and Jeremy, I really care. You made a hard-hearted Supervisor Hood cry. And that's all I have.
Thank you, ma'am. Ms. Addington.
I too thank all the staff and everyone in the county office here for all your hard work and everything that goes on behind the scenes that $350 doesn't pay for, you know. But anyway, Jeremy, I am really going to miss you. I am really going to miss being able to, well, I'll just say this. Just because you're going to leave doesn't mean we can't call upon you to say, hey, help.
And get advice.
And get advice. So yeah. And it is good to see Daryl back.
Good to be back.
Good to be back.
Save myself the last, I can do that. Sally made a copy of that MOU from the Nicholsville Park, and I was reading through that, and what Mr. Vickers stated about them having the authority to make that decision, I don't see it in there. Anyway, something to think about. We'll talk about more in June, but you got a copy of it, and I went through this. Sally, did you see anything in there that would give them the authority to
Only
decide?
glance through or that through. I don't think so.
I don't think so either.
For your all's
Yeah.
reference.
But anyway, this was signed, and I signed it back in 2012. Shoot, I was brand new out of the box. Anyway, look at this and be thinking about how we need to proceed with that. But anyway, that's it. One other thing, I was approached, and Stephanie might be have to chime in on this. The Methodist camp at Fort Blackmore, they're doing a lot of work there, and they're building a swimming pool. They're rehabbing the old one, and they're spending a lot of money. And I was asked in a roundabout way, and I talked to Ms. Cagle about it. I want her to find out if we could do anything to help that. I asked could the pool be used by people other than the church group, and he said yes. So I don't know. It's Methodist camp. It's a church organization, but if we, I don't know. I don't want to do something here that would cause other churches to say, well, we're building something, we want you all to help us do that too. I don't want to set a precedence here that would cause that. But anyway, that they're spending, well, they had a $100,000 gift to help do it. That's not enough to do it. The parking at the pool at Natural Talent, $4 million to fix it, so you can imagine what it's going to cost for them to fix that pool there at the Methodist camp. Think about it for the next time. I don't know, but we'll let Ms. Cagle research and see yay or nay, and I'm not so sure we can, it being a church-affiliated facility there. That's just a camp area. They got a meeting room, and they're rebuilding the swimming pool, doing all that. But something to think about for the next deal. Anyway, Jeremy, thank you. We'll hug and cry in August. All right.
Well, I didn't think I'd do that, but.
That's all right. That tells me one thing about your heart's in it. And your heart's in the right place. That's what that tells me. So, all right, anything else before we adjourn to the budget shop?
Hey, Danny, on the tank, Can we make a motion now to give $1,000?
Sure.
Contingency?
We can. Do you want to do that?
I'd like to make that.
All right. Mr. Jeter has made a motion for $1,000 from our contingency fund to this memorial. The tank only be worked on, is that it?
It'll be on that fund. Yes.
Okay, all right, but anyway, all right.
The Veterans Memorial
Yeah.
Fund.
If you get a chance to come out and look at it, there's a big cannon sitting there too, and got the memorial thing, got names on it, and the tank is sitting there, so anyway, did you make a motion? Do we have a second?
Second.
Mr. Ricky, second, any discussion? All in favor, vote by saying aye.
Aye. And
Opposed?
I'll abstain.
Okay.
Since I'm the commander of the Marine Legion.
All right, that'd be fine. All righty, so we're gonna take a break here, we'll adjourn to the budget workshop. Anybody have anything else? All right, we'll come back when we get through it.
You want to order something?
Lunch